Hello students and friends. Welcome to Homeopathy Medicines. Today in this homeopathic materia medica lesson, I will discuss about homeopathic medicine Squilla maritima. Before starting this video, please subscribe to this channel for Learn Homeopathy Online Free and Homeopathy Materia Medica. We need support from you to make this channel more beautiful and more informative. Now going to discuss about Squilla maritima, its uses and symptoms. A slow-acting remedy. Corresponds to ailments requiring several days to reach their maximum. Persistent, dull, rheumatic pains permeate the body. A spleen medicine, stitches under left free ribs. Important heart and kidneys medicine. Bronchopneumonia. Acts especially on mucous membranes of the respiratory and digestive tracts, and also upon the kidneys. Valuable in chronic bronchitis of old people with mucus rales, dyspnea, and scanty urine. Eyes, feel irritable, child bores into them with fists. Sensation as if swimming in cold water. Stomach, pressure like a stone. Respiratory, fluent coryza, margins of nostrils feel sore. Sneezing, throat irritated, short, dry cough, must take a deep breath. Dyspnea and stitches in chest, and painful contraction of abdominal muscles. Violent, furious, exhausting cough, with much mucus, profuse, salty, slimy expectoration, and with involuntary spurting of urine and sneezing. Child rubs face with fist during cough, quast, pulls. Cough provoked by taking a deep breath or cold drinks, from exertion, change from warm to cold air. Cough of measles. Frequent calls to urinate at night, passing large quantities, Fosace. Sneezing with coughing. Heart, a cardiac stimulant affecting the peripheral vessels and coronary arteries. Urinary, great urging, much watery urine. Involuntary spurting of urine when coughing, caustic, pulls. Skin, small, red spots over body, with prickling pain. Extremities, icy cold hands and feet, with warmth of the rest of the body, minianths. Feet get sore from standing. Tender feet with shop girls. Modalities, better, rest, worse, motion. Squilla was given in the olden times by the old school in all lung, bronchial, and kidney affections, pneumonia, asthma, scanty urine and dropsical affections. Cough, has a loose morning cough and a dry evening cough. Alum, carbo-veg, Fos. AC, September, Stram, pulls, Squilla. Pulls. And Squill. Being strong here, but Squill. Has a hard cough, coughs, gags, sneezes, urine escapes and quite frequently feces. The patient coughs until he is covered with sweat, he gags and coughs and finally succeeds in raising 2 or 3 little lumps of white, tenacious mucus. It is a spasmodic cough caused by mucus in the trachea or a tickling, creeping sensation in the chest. The loose morning cough is worse than the dry evening cough. Patient chilly, cannot have the least draught, wants plenty of clothing and is very sensitive to cold, not so in pulls. Urine is generally copious, watery, colorless. About 2 a.m. to 12 or 2 p.m. There is the most dyspnea from filling up of the chest with mucus. This same feeling returns during the hour, but it is from cardiac weakness. Copious, colorless urine is one of its important symptoms and resembles acne, but Squill is not a hysterical patient like acne. Quite similar to can, hid, or gels. In brain affections, but Squill has not many brain affections nor many febrile symptoms. Fos has inflammation of the brain, and when the dangerous turn comes, this increase of urine is a bad sign. Pulls. Tearful, then copious urine. Squill. Copious, colorless urine in diabetes. When this seems to disappear and chest symptoms appear, these troubles disappear and kidney troubles appear, these would disappear and dropsy comes up. When the urine would get copious again, these dropsical symptoms would disappear and Squill acts a long time. There is a copious, colorless flow from the nose, more especially in the morning. The cough is similar to tart. Emet. Squilla. In its internal nature is quite like thuja in regard to its spurting urine and its spasmodic cough. With the escape of urine there is more or less of escape of feces of a dark brown or black fluid in frothy bubbles, very offensive, painless, involuntary. Respiration difficult with stitches. In the chest when breathing and coughing. Great dyspnea, the child cannot drink, seizes the cup eagerly, but can drink only in sips, frequently obliged to take a deep breath which provokes a cough, shortness of breath on every exertion. Pains in the chest aggravated in the morning. Dull rheumatic pains aggravated when exercising, ameliorated while at rest. Evening dry cough with sweetish expectoration. Great heat in the body. Follows well after brie. Absolute lack of sweat as a characteristic. Dry cough at 2 p.m. Worse from cold water and cold air, rheumex. Bell. Has cough at 2 p.m. Worse from uncovering. Red face, congestion in head. Latch. Soon after going to sleep, which may be 2 p.m. Nasal discharge acrid, corroding, worse in the morning, violent sneezing. Stool dark brown or black. Seldom much cough during day. Pneumonia. Stitches when inhaling, jerking pains, always right side, catarrh of the chest and threatened pneumonia after hemorrhage from the lungs. Soreness in the chest. Worse from motion. Brie. Will often palliate and the case will go into Squilla. Thanks for watching this video. If you want more videos like Squilla maritima, please subscribe to this channel and press the bell icon. To learn homeopathy course online free with Homeopathy Materia Medica. Comment us your feedback and what you want in the next video. Like and share this video with your friends and family. For paid and free consultancy online, visit homeopathymedicines.com and mashclinic.com. Thank you. Have a nice day. Stay healthy, stay happy.